13 years ago, I chose psychiatry as my profession. And today, after 13 years of listening to people, understanding their struggles, and watching them heal, I can honestly say psychiatry is not just a career. It is a profession where you get the opportunity to change lives. But what exactly is the scope of psychiatry in India? And is it really a good career choice? Let me share my journey with you. Hello everyone, I am Dr. Sudharani Naik, a psychiatrist and a mental health professional. My journey in psychiatry has been filled with experiences that have changed the way I look at people, relationships, and life itself. Over these 13 years, I have met people struggling with depression, anxiety, panic attacks, sleep problems, addictions, relationship difficulties, childhood traumas, and many other mental health conditions. And one thing I have learned is this: you can never truly understand a person's behavior until you understand what they are going through emotionally. What does a psychiatrist actually do? Many people still think a psychiatrist simply prescribes medicines, but psychiatry is much more than that. A psychiatrist evaluates mental health conditions, understands biological, psychological, and social factors, provides medical treatment when needed, and works with patients through their recovery. Psychiatrists may work with children, adolescents, adults, and older adults. They can work in hospitals, psychiatric clinics, rehabilitation centers, academic institutions, emergency settings, research, and increasingly in community and digital mental health services. So, let me tell you the scope of psychiatry in India. So, what is the scope of psychiatry in India? I would say the scope is enormous. Mental health awareness is increasing. People are talking more openly about anxiety, depression, burnout, addiction, sleep problems, relationship difficulties, and emotional well-being. Schools and colleges are becoming more aware of importance of mental health. Workplaces are also recognizing the impact of stress and burnout, and families are slowly becoming more comfortable seeking professional help. This means the role of mental health professionals is becoming increasingly important. Psychiatry is not just medicine. One of the things I love about psychiatry is that you don't treat only the diagnosis. You meet a person, you hear their story, you understand their family, relationships, work, fear, strengths, and struggles. And sometimes the most powerful part of treatment is simply giving someone a safe space where they can finally say, "This is what I have been going through." That conversation itself can become the beginning of healing. If you're a medical student wondering about psychiatry, there are several career pathways. You can build a clinical practice, you can work in hospitals, you can pursue teaching and academics. You can work in addiction psychiatry, child and adolescent psychiatry, geriatric psychiatry, consultant liaison psychiatry, and other specialized areas. You can also explore research, public health initiatives, mental health education, and professional content creation. And with increasing awareness of mental health, the need for qualified professionals is becoming more visible. My biggest lesson after 13 years. After 13 years, one thing I know is for sure: mental health is not luxury, it is an essential part of overall health. And being a psychiatrist has taught me something very important. Sometimes people don't need someone to judge them, they need someone to understand them. And being able to play even a small role in someone's recovery is incredibly rewarding. If you are considering psychiatry as a career, don't choose it simply because you think it is an easy branch. Choose it if you are genuinely interested in human behavior. Choose it if you are willing to listen. Choose it if you are willing to listen. Choose it if you can be patient. Choose it if you want to understand the person behind the symptoms. Because psychiatry requires both medical knowledge and humanity. 13 years later, I still feel grateful that I chose this path. Every patient teaches you something. Every story reminds you that you never really know what someone is carrying inside. And that's why I believe the future of psychiatry in India is not only promising, it is necessary. If you are a medical student, aspiring psychiatrist, parent, or simply someone interested in mental health, tell me in the comments. Would you ever consider psychiatry as a career? And if you want to hear more about my journey as a psychiatrist, therapist, mother, and mental health professional, follow and subscribe. Because this is not just my profession. This is my 13-year journey of understanding minds and changing lives.